Welcome to the most impactful week in the movement to end prostate cancer. We're so glad you're here. This event is about you and connecting with experts, advocates, and communities from across the country. Together, we are Zero Strong. Please join us right now for the virtual Zero Prostate Cancer Summit.
Thank you to everyone for tuning in to Zero's 2021 Virtual Summit. My name is Shelby Monier, Vice President of Patient Programs and Education here at Zero. I'd like to give a special thanks to our sponsor, AstraZeneca, for partnering with Zero on this presentation. Joining me today is Alison Sachs, who will be discussing mental health and prostate cancer. Alison sits on Zero's Medical Advisory Board and has been recognized nationally for her leadership in the field of oncology social work. Alison, thank you so much for spearheading today's discussion.
You are very welcome. It's my pleasure to be here. Really, it is. So let's get started. I'm just so delighted to be here, as Shelby mentioned, sitting on the Medical Advisory Board, having been involved with prostate cancer patients and their loved ones for close to 20 years. This is a topic very near and dear to my heart, because the truth is, as the first slide says, how to get from here to there. In any cancer diagnosis, we have to stop and think, okay, life has changed for me. What can I do about that? What can I do about all of these feelings? What does my loved one do with all the feelings they have? And the truth is, during this whole pandemic, that's really been heightened. So let's see if we can walk through together and come up with some ways to identify what's going on, ways to identify our feelings. And then I'm going to be as straightforward as I can to share good tips that'll help you move through this. We all know this. I mean, you all can read the slides, but there are 3 words that no one ever wants to hear their physician say to them, which is you have cancer. And certainly that immediately heightens all kinds of thoughts, feelings, emotions. Add our pandemic that's going on, and we are adding an extra layer of stress and anxiety to what's already become a complicated situation for us and our loved ones. So what I want to do first is use a big word, kind of create an umbrella that we can work under. And that word is stress, for distress, excuse me. For some of you that are in cancer centers, you might have been handed what's called the distress screening questionnaire. It's a big word, and under it falls a lot of different things. But I want to first use, and I love Dr. DeShield's kind of description of what distress is, because it's really a common reaction to cancer. And in general, whether it's cancer or anything, distress makes you feel as though the world has blown up around you. You can't handle what you've just been told, what you're facing, what you may have to do. And distress can occur, whether it's mentally for you, in your mind and how you're feeling, whether it's in your body, physically, literally the distress your body is feeling. It could be socially, I don't know how to talk to people about this, about me, about anything. And certainly it can be spiritually. How many times have all of us said, why me? What's going on? Whether you believe in a higher power or not, but it's, kind of like that, why me, God? How did this happen to me? And it could be in any one of combination of these ways that this big picture word distress happens. And what we want to look at when we use the term distress is what causes it? What's the root cause? What is going on? And as we did here, I mean, there's lots of different reasons, the mental, the physical, the social, but what's the cause of this distress? Well, everyone's different, everyone's circumstances are different, but there's really kind of 3 big things that fall under stress. It can be practical issues. How am I going to get to radiations 5 days a week for how many weeks? How am I going to get there and back? I live alone, or my significant other's working, or whatever that is. There are obviously financial concerns. I don't think I'm surprising any one of you with very good insurance to hear out of pocket expenses for cancer care, regardless of your insurance, mount up. and they build up, and that can be a concern. Also, maybe it can't work during some of the treatment. That might be a concern. And then certainly there are treatment side effects. And I have to be fair and honest. And again, this is nothing you all don't know. The treatment side effects specifically for prostate cancer are particularly distressing for men and for their significant others. So we're going to talk about all of that again, and what the emotions are that are tied to these issues, and then some tips and ideas on what we do about it. So sorry, I'm looking at the little emojis and laughing at myself for choosing them. But truthfully, thoughts and feelings around distress are very significant. Your mood, your emotions, you're up, you're down, you can cope, you can't cope, you can talk about it. No, I can't talk about it. They're kind of all over the place. And sometimes they're stronger than other days. And being able to discuss them and identify them really makes a huge difference for you personally, for the people you live with, and certainly for your healthcare team that wants to help. Because again, we're using this big term about distress, but we don't know what that means for you. So let's tie in some real feeling words, emotion, to being in distress. And we can describe it in saying that we'll have a lot of fear. Certainly there's fear around getting a prostate cancer diagnosis. There's fear around getting a prostate cancer diagnosis during the pandemic. I had higher risk for getting that COVID-19. Why am I at higher risk? What can I do differently? There could be some frustration around, I don't understand. I kept my weight under control. I'm careful about what I eat. I'm really, really so healthy. I don't understand how this happened to me. There's certainly a feeling of being overwhelmed. Everything comes at us so quickly. You will hear me say this throughout the presentation. Which is, nobody gives you a playbook for how to deal with getting a cancer diagnosis. That just does not happen. So I think that's really, really important. Thank you so much. Important as well to understand and know. There's some loneliness. I often share when I speak about being a cancer survivor and that feeling after I received my diagnosis and walking out into the world or work or going to the food store, whatever it is that I did in a normal day, looking around, feeling my life is turned upside down. Things are really different for me. I feel different, but all those people don't. Everything's the same for them. That could be very isolating and a very lonely feeling. So along with that, all of that, you may feel none of it, some of it, different times, different things. There's also two different feelings or emotions that we hear a lot, and that's the term anxiety and depression. And they're very different, and they usually get intertwined, and we're going to talk a little more about them and how you identify them. We also want to talk a little bit about the fact that prostate cancer is a diagnosis of men. Surprise, women don't have a prostate, you don't get prostate cancer. And society-wise or socially, we will find sometimes that we have raised husbands, fathers, sons, you're a nephew, you're a grandson, you're a brother, but mostly men take on the persona or this role about being strong and protecting those they love. And that's completely normal. We like that, we want that, but sometimes it can make it hard to share those thoughts and those feelings during those really distressing times. When we talk about distress and how we're feeling, as I mentioned really briefly, those last two on that bottom line, that anxiety and depression, we really want to be very careful. Anxiety is that feeling of, that dread in the pit of your stomach, or that we call it a monkey chatter in your head. But it comes and it goes. And it's, sometimes it's worse than others. Sometimes it really abates. Sometimes it goes away almost completely. We're anxious about what's going on. We're concerned about what's going on. That's fine. And there is anti-anxiety medication. You don't become addicted to it. It works really well. You might need it at the beginning of a prostate cancer diagnosis or the beginning of treatment. You may not. But more importantly is what we want to talk about when we separate anxiety, which I just explained, periodic, kind of that feeling in the pit of your stomach, oh, here it comes, from depression. Depression is very different, and there really are two different types of depression. So there's situational depression, which we want you all to be aware of and know about. And it's kind of like, yeah, you have cancer, of course you're depressed. That's really normal. And again, that comes and goes. It is a great feeling of sadness, but it's manageable. It's, okay, I really don't want this to happen or be, but okay, let's move forward. What we're more concerned about and want you just to be aware of, and I would be very remiss in this presentation if I didn't share with you, the signs of clinical depression. Remember situational depression, clinical depression. Clinical depression is a diagnosis. It is very noticeable fairly quickly because it's great highs, great lows. It's kind of yin and yang. It's all or nothing. Eating way too much and constant and all, just kind of shoveling food in or having almost no appetite at all. It's sleeping constantly or kind of being withdrawn, almost sleepiness, kind of reaction to things, or not being able to sleep, up insomnia night after night after night. And with signs of clinical depression, those feelings of sadness and irritability, which are, again, not uncommon with situational depression, those grow stronger over time. They don't lessen as you go through treatment and go, oh, radiation is as bad as I thought, or, oh, I went through the surgery. I'm going to do this okay, or, okay, I have more advanced disease, but I can cope, and there's just so many treatments today. This is long-term. I got this. When you can't get that feeling under control, when it grows and it grows and it grows, that's clinical depression, and that needs to be attended to. It's really, really important. You need to share with your healthcare team how you're feeling. And again, we could talk a little more about that in a minute. So we have this big term, distress. We talk about those feelings that kind of fall under that umbrella. Talked about the difference between situational depression and clinical depression. All that's really important to know about. And again, all of this is truly heightened during the pandemic. So what do you do about it? How are you going to move through it all? Well, the first thing I'm going to do is just say, okay, all this is just causing a tremendous amount of stress. Stress on my body, stress on my mind, stress on my family, stress on my marriage, stress on my relationships. It's just a lot of stress going on. What can I do? Well, the first thing, and I would have said this no matter what, but boy, do I stress this now in this environment in the last year. The health environment with the pandemic, the social environment, the political environment. Let's set some limits first and foremost. That's about control, isn't it? We want you to stay informed. I work in a hospital setting. It's really important to get the news out to our community on what's going on, what we're doing about it for their health during pandemic, when they were getting their vaccine, when they weren't getting their vaccine. That all occurred, right? Just a short time ago. So we want you to not turn off the news, but we certainly want you to limit it. This constant stream of media, and take a look at the faces on the screen of the media personalities. I don't care what you're listening to, NPR, National Public Radio, CNN, Fox News, MSNBC, your local nightly news. Let's limit it. We know, was it maybe in the 70s? I'm not really sure exactly when it was. When they started talking about subliminal messaging, do you remember that? When they talked about, hey, those commercials on TV, there's stuff and sayings and creating info in the background that's kind of up in the back of my head. influencing how I'm feeling, what I might do. Well, it's the same thing if you constantly have media on, whether it's radio or television, or you're constantly looking at your phone or your iPad. It's that droning on of gloom and doom. That is not helpful for anyone. We need to set some limits on that. It's important. Maybe you listen to your local news for this amount of time, or your favorite news station for your favorite news personality for a certain amount of time. But let's set some limits. We can also reduce stress by avoiding scheduling conflicts. And you'll forgive me, but I happen to think Kevin Hart is extremely funny. And he's always saying, relax, man, just relax. And the truth is, that's how we reduce stress too. So what can we do? Well, we can avoid scheduling conflicts, certainly. I think, okay, you can all yell at me. This might be an unfair thing to say in this day and age of being so politically correct. But I really think women tend to be a little better at this. Maybe those who have children are better at it because they have to monitor where all they're going in different places and what they have to do and where they have to be. But I really urge you guys to use a day planner of some kind, or your phone, an online calendar, whatever it is. But be able to track your appointments and your activities. What's next? What do I have to do? So instead of having it sit in your mind all the time, oh, right, yeah, I better not forget. I was late the other day for radiation. I really gotta. Instead of having that, you know that it's written down. All you have to do is look at it. There it is. Oh, right, let me look at my calendar. Let me check my phone calendar and see when it's due. And by doing that, what it also allows you to do, which is that second bullet point, is it allows you to time things well, right? So you have plenty of time between one activity before you go to the next. The other is about cancer that sometimes creeps up on some of us. And sometimes if we don't stop and sit back and take a breath, we don't realize is it can be very exhausting. Whether it's physically exhausting or emotionally exhausting, it doesn't matter. It can be very tiring. So it's really, really important when you have that planning and you avoid scheduling conflicts and you don't plan one thing right after another. It gives you time to prepare. It also gives you some break and rest in between, which is hugely important. We also want to be aware of our limits. We are a culture where saying no is usually not okay. Oh, they're so difficult. They're so negative. Oh, I never say yes. Negative Ned, negative Nelly. But especially when we have a life-changing diagnosis like cancer, we need to be able to say no comfortably, and we need to focus on what we can say yes to and have the energy and the time to say yes to. So we have to be clear on that. What can you do? How can you do it? How have you scheduled it correctly? And then how do you communicate that to others? How do you say no? The other thing to talk about is the ability or the need or the want to ask for help. Again, this seems to be harder for some people more than others. That could be upbringing, that could be a lot of things. But the truth is, again, when you have a diagnosis of cancer, things have changed. You're still you, there you are, you're right there. But everything around you has changed. Your control of your schedule has changed. Your physical body, there have been changes. How you're thinking and feeling and coping have all changed. So asking for help is so important at this point. It really is. And maybe we just need to ask for help for concrete things, for really things that need to get done that maybe you're not up to getting done, or you don't have the time because of your treatment schedule. Certainly you don't have the energy to get done. That's when you ask for help. And I urge you, for those of you at the beginning of your prostate cancer journey and your treatment journey, to think about that. What can you ask for help with? What can you do? And who can you ask? A little thing I did when I had my cancer treatment and diagnosis. I picked everything I hated doing. That's what I asked for help with, and handed that out. It also allows those people in your life that love you and care about you and don't know what to do, it lets them in. It lets them feel a part of doing something for you because they love you. It doesn't make you weak. It doesn't make you needy. It makes you saying, we're a team. Come on, you can help me do this. Let's get it done together. The other thing is to prioritize tasks. We talk about scheduling and asking for help, but prioritizing tasks is really important. So if you have daily tasks that you do, whether it's work tasks, whether it's at home tasks, prioritize them. Put the important ones first and get those done. And that also helps you make that list of what you can ask folks to help do for you or maybe with you. But if you prioritize things, actually, this is a good tip in life in general when we're feeling overwhelmed. Put the most important things first. Focus on those. Ask for help with those. Notice, oh, that's way down on the list. Okay, we can get to that later. Again, all of this, the prioritizing tasks, the scheduling, the asking for help, knowing what your limits are, being able to say no, this is all part of the concept of control. What can you control and what you can't control? Because concentrate those efforts on what you can. So something that's stressing you out in life, something that's causing stress, distress, it may be something you can't control or change. Even with the best planning, there's nothing you can do about that. You can't wish your prostate cancer away, out of your control. So the more flexible you are, the more your stress lowers. Because the only aspect of a problem you can't control is how you react to it. During a pandemic, we've talked a lot actually in my family. My children and family are all over the United States and lots of different experiences with this pandemic. But there was a lot of talk about just everything's out of control. It's just awful. We can't control this pandemic. So what can we control? Well, I have one right here. We can control wearing masks. We can't control someone else wearing a mask, but we can control we wear a mask. We can control distance, 6 feet apart. We can't make someone else, but we can move 6 feet apart. What can you control? Take a look at those tasks, take a look at those priorities, take a look at your schedule, talk with someone about it, and focus on what you can control. I guarantee you that will lessen those feelings of anxiety and stress. And recognize, I laugh because I'm so sure, look at the guy's hands. I'm so sure this is in New York City. I wish I could see more outside of the pictures. It's just such a New York thing to do, right? But you can't control someone else's reaction to this. You can't control traffic. It doesn't help to be this. This doesn't work. So focus on what you can control, and that will lower things. So we focus on some things. We had some ideas, talking about control and scheduling and asking for help. Let's look at some strategies, okay? And we really should try to reduce the number of stressors in our lives all the time. Stress isn't good for us. Some stress is, it's that fight or flight. We need to be stressful at times to protect ourselves, to protect others. I know I tend to be a last minute person, so I kind of need that stress to get some work projects done. I don't like the way it feels. I get kind of nervous and anxious, so I have to move and get it done. But you can't completely avoid stress. It's not possible to do that. All those tips, again, going back, we can talk about it. What can you control? Tasks, asking for help, being aware of limits, avoid scheduling conflicts, all true, and all wonderful ideas and things to focus on, but you can't control everything and you can't completely avoid stress. But there are strategies. And you may not be able to tell. It kind of looks like an ugly, weird tennis ball on the left of my screen. But what it is a stress ball. And I highly, highly recommend stress balls. I think they are really wonderful. Put one in your hand. When you feel that, oh, you're waiting online at the post office and they are unbearably slow, you can't get things done, or that traffic, or you're sitting and waiting to see the doctor for how long? Have that ball in your hand. It's a great reminder. Just kind of squeeze. It's a little ball. No one even really has to see it. Keep it in the pocket and go, oh yeah, that's right. Okay. I know this is something I have to let go of. I'm okay here. So some strategies that you can do right away is exercise regularly. This is not new to any of you, this moderate exercise, a 30-minute walk, and I'm not talking about every day. I'm just talking about maybe a couple of times a week, if you can do that physically. If you can't, you know what? Can you walk from your bedroom to the living room? Can you walk from your front door to the mailbox? Can you walk around the outside of your house? Or if you're in an apartment, can you walk on the floor of your apartment building? Just a little moderate exercise. This is proven. Moderate exercise helps lower stress, it improves sleep, and it helps all of us cope with anxiety and/or depression. That's important to know. It's also important to know about how to schedule and to make sure that you schedule some social activities, especially during this pandemic, because it really, really has changed all our lives socially, hasn't it? It's so different. You know, we can't just gather a group over for dinner or meet folks at a restaurant or, join our team and play a game of whatever. So we have to really, really focus on scheduling some social activities. During a pandemic, you can spend one-on-one time with friends. You can. Here we go again. Put that mask on. Keep some distance. Look at the pictures. You can do this. Get outside with your friend. We know that being outside is safer and better for us. If you're in cold climate, bundle up. I'm not telling you to go outside in the pouring rain, but it's okay to bundle up, put your mask on. Some video calls, for those of you that are video and tech savvy, they work wonderfully. My kids got together and got us that little Echo Dot. This is not expensive. Of course, it took us forever to learn, those of us my age, how to use it, but we could drop in on one another. So I can drop in on my kids and boom, there they are right away. There's FaceTime, the phone we can use. Try some old-fashioned communication. Look up on the screen again on the right-hand side. Letter writing is a wonderful, wonderful way to communicate. And guess what? There's no time limit on letter writing. You know, you don't have to get to it right away. You can start it, get back to it. It's almost a lost art. It's really lovely. It's lovely to receive a letter back in the mail nowadays. Try it. There's also a bunch of real life activities that have gone virtual. And again, we're talking about stress management. You can use these when there's not a pandemic. We're trying to kind of shift. What's the word everyone's using right now? Pivot. Yeah. Pivot things so that during this pandemic, how do you manage the stress and what's going on? Well, look at what's gone viral, from book clubs to meditation sessions, yoga, exercise, cooking and art classes, even choirs, singing in choirs have gone virtual. Ask friends, what are you doing? What are you doing online? My husband, who just retired, when the pandemic hit, he had all these great plans for all these volunteer things and going to the gym. Couldn't do any of them. So what did he do? He took up painting. And he went online and watched YouTube about different ways to paint. Doesn't cost anything. And he's been painting. So it just is that ability to reach out, figure out something different, get it done for you. You will feel better if you do that. And along with sleep and being social and finding some new activities, we know that maintaining a healthy diet and getting enough rest will give you more energy. The more energy you have, the better we cope. The better we cope, the less we feel stressed. It's really, really as simple as that. Think about it, please. And then sleep hygiene. Listen, this is a whole, we could do a whole presentation just on sleep. Sleep medicine is a booming, almost new field in the field of medicine. And we know with prostate cancer patients and cancer patients in general, there's a lot of disruption in our sleep. Now, one of the things to recognize, not for everyone, but for some, as we get older, and cancer in general is a diagnosis of older folks, as is prostate cancer, not everyone. Our sleep becomes disrupted as we get older to begin with. All the things we talked about previously, we're going to help with that. Being social, letting go of some control, or recognizing what we can control, eating well, getting exercise, all of that helps with sleep issues. But there's very, very specific sleep hygiene things you can do. Before you go to bed, read or meditate. There are breathing exercises, and we're going to get to some of this again in just a little bit, how to do it. There's breathing exercises. Keep to a regular routine. I don't know how many of you, I'm not trying to remember how long ago it was. It could have been a year or two. And I believe it circled on Facebook and other social media. I think it was a Navy admiral, was giving a commencement speech. And he talked about the importance of making your bed every morning. You want to have a successful life. You want to be able to accomplish things. You want to feel in control. Get up and make your bed every morning. And actually, what many of you probably do not know, in inpatient rehab programs for drug abusers, the first thing they teach and you are required to do is get up, make your bed, and brush your teeth. Well, what does that tell you? It says that it's a routine, that there's a sense, this is what I do, this is what I'm required to do, this is what I can control. It gives you a routine. And when you have a regular routine, you feel more in control and you feel less stressed. It will also help you sleep better. Same time up, same time to sleep. Listen to relaxing music or an audiobook. That can be very lovely. And there are timers often today on phones or on alarm clocks, I should say. You want to avoid drinking too much alcohol. The truth is, you shouldn't be drinking alcohol at all anymore. The connection between alcohol and numerous different cancers, there's more and more research coming out about that. Yeah, a glass of wine, I guess, okay, every once in a while is fine. The American Cancer Society used to say, up until 2020, by the way, used to say, for women, it was 4 ounces of any kind, beer, wine, hard liquor, 6 ounces, no more than a day for men. And that didn't mean that you could save it all up and have it all on Saturday night. That's not what that means. But actually, the American Cancer Society has stepped back on that recommendation, as have most cancer organizations today. The connection between alcohol and cancer is pretty significant, and we see it often. But we're talking about sleep hygiene, so I'll stop lecturing about drinking. And sleep hygiene really, yes, alcohol will help you fall asleep. It'll help you with that stress. A lot of people who feel a lot better after a drink or two, or 3 or 4 are in trouble, but they do. The problem is that you're then going to wake up if you're drinking before you go to sleep. That's a given. Alcohol disrupts your sleep. The last thing is avoid those electronic devices, your smartphone, your computer, your tablets. They disrupt your sleep. There's something about the light from the screen. Y'all can see that I'm wearing glasses. These are not glasses to read. These are actually blue glasses to protect my eyes from the screen because I do a lot of computer work. There is a change in your sleep rhythm, your circadian sleep rhythm that comes off these lights from the screen. So be careful about that. And certainly, you know this, avoid caffeine and large late dinners. And by the way, for those of you who do eat later, and perhaps have dessert, if you're having chocolate, chocolate has caffeine, and that might contribute to having sleep problems. Okay? Another stress management strategy that's obviously near and dear to my heart, I have facilitated our prostate information and support group for over 15 years. And I have seen firsthand the importance and the benefit of an information and support group. And I hope you all see that I put that word information in first, because I really, really believe that a group needs to be informative, and in and of itself will be supportive when it's informative. Being able to share and talk about what you're going through really will help you start to understand your experiences more. It is true, when we verbalize it, it becomes more real, and we can take a clearer look at it. Sometimes we'll say, write it down. You've heard that as well. Those things work. It's important. But I always, in our groups here where I work, are always called information and support, because these groups should be a place for education, information, myth busting, and togetherness. So it isn't just about sharing feelings. It's about, oh, really, your doctor started you on Zytiga. Did you have side effects? What was that like? When did that happen? Oh, you're taking Lupron. How often? Do you take a 3-month shot? You couldn't get Lupron. I couldn't get Lupron either. What happened to Lupron? They gave me Eligard. What's Eligard? I don't understand. How much radiation did you have? Did you have seeds, proton beam, external beam? Why did you do that? Being able to talk about everyone else's experiences and hear what they're going through, we're all different. You're all at different stages. Your treatment options are going to be different based on your age, the extent of your prostate cancer, lots of different things. What we call comorbidities. What other? Do you have high blood pressure, heart condition, diabetes, whatever it is? That all affects how you're treated and what treatment you get and how long it lasts. But it's good to hear what others are experiencing. What are their options? You become an educated consumer. Don't we all want to be that? Don't we all recognize that makes things better for us? And it certainly will help you go, oh, I'm not alone in this. It's a good stress management strategy for sure. And then it's so important to schedule daily relaxing time, whatever that is for you, however you find relaxation and enjoyment. It's really important. Identify it. That's one of those things we talked about, asking for help. You can ask a family member, a friend, remind me, ask me what I did today to just have a little quiet, relaxing time. That's self-care. Self-care is enormous for your well-being during cancer, during a pandemic, during life. It really does make a difference. Now, some other strategies for stress management. I talked a little bit, I mentioned this briefly, but write it down. Right away, when you write something down and put it on paper, you kind of can take a step back and go, oh, I didn't even realize I felt that way. So keeping a journal, for those of you that like to write, not everyone expresses their feelings with words. And if you're a significant other, a family member, a friend, a spouse, a husband, a wife listening to this, that you mean identify that the person you love doesn't really share their feelings by words. Maybe you can recommend to them, write it down instead. Keep a journal. Learn a new hobby. Okay, don't yell at me about the drums and the harmonic. Maybe that wasn't I should have found something else. Make a little noise. But, learn a new hobby. Learn something different. Again, I shared with you, for my husband, it was painting. I don't know what else it could be for you. Is it cooking? I don't know. Is it working with clay? What is it? Woodworking? Learn a new hobby. First of all, this is very good for you. It's good for us as we get older. Many studies have shown it's just good for our brain to force it to learn something new. But it's also good because it takes your mind off of you. And that's important when we want to lessen our stress. And keep a routine and make a plan. And this is, again, we talked about it for sleep. We talked about keeping a schedule, writing everything's down. You want to keep a normal routine. That helps you feel in control of your daily life. Because, yeah, you now may have cancer, but you're not prostate. Prostate isn't who you are. Prostate cancer is one other thing in your life that you are dealing with right now that you're getting treatment for. You are the person you were before. Circumstances have changed. Feelings have changed. But you are who you are. And keeping a routine and set things that you do make a huge difference. Now, add some new things, learn some new things. That's a great thing. Incorporate them into your routine. But feel in control and know that the day is yours. Yes, you may have to go for radiation. Yes, you may have to go for a Lupron or Eligard shot, or maybe it's time to get your blood draw for your PSA. All of that's true. But have your own plan, your own daily routine. And I urge you to incorporate some of these other strategies that we've talked about. So, deep breath. We've talked a lot, or I've talked a lot. You've listened. I hope it's been helpful. We identified that term of distress. So we identified feelings under distress. We talked about some strategies in dealing with those that distress and those feelings. So strategies are, hey, in general, Now let's talk about techniques that are just yours, that you can use for you to feel better, to cope, to feel that distress and all the feelings that fall under that umbrella in distress that are connected to having a diagnosis of prostate cancer or being in treatment for prostate cancer, but especially is heightened during the time of the pandemic. What can you do to lower that feeling of stress? And these are things that you can really, really use daily. There are very specific things that you can use during certain procedures, and they're really, really helpful. So let's talk about relaxation or deep breathing. Okay, this is deep, slow breathing while concentrating on filling your lungs and relaxing your muscles. And let's try it real quickly. We can do this together. Take a moment, okay? And you can take that breath for a minute. Where are your shoulders? Make sure they're not up here, up by your ears. Make sure they're dropped and back, kind of like you're pushing your wings to touch each other, your shoulders. Put your feet flat on the floor. Put your hands on your thighs, just above your knees. And let's just try it so you see what it's like. Some slow, deep breaths. In through your nose. Out through your mouth. One more time, do it with me. Now you can do this anytime, anywhere. You can do it with your eyes open. You can do it with your eyes closed, except of course if you're driving. Please don't do it with your eyes closed if you're driving. It's very helpful. It makes a difference. There's a reason we talk about the breath all the time in yoga and other exercises. So don't forget, that's within your control. That's something you can do anytime. It really works. It helps. We don't want, that's not good. You'll pass out. It's relaxed in through your nose, out through your mouth. That's all. Do it a couple of times. See how it feels. There's also mental imagery or visualization. Sometimes you'll hear it called guided imagery. This helps you create a peaceful or relaxing image in your own mind. Whatever it could be. Years ago, I was leading a group and I suggested that because my favorite place is the ocean, and this woman's eyes burst open because she almost drowned as a little girl. So that was not a good idea. So I'm not going to tell you what your mental imagery or visualization can be or should be. But I can tell you what mine is and was. One of my biggest joys in life was starting as a youngster playing golf just with my dad. It was our time, just my dad and I on the golf course, and it was wonderful. And so with mental imagery or visualization for maximum effort or effect, excuse me, you do need to close your eyes. And what I would do and what I urge you to do is pick that one thing that you just love, or that one place that you love being, or that one person you can visualize yourself being with. Close your eyes. But I want you to start at the very beginning. So I'll share with you what I would do. I literally would start with going and getting my golf clubs and putting them in the car. But before I even put them in the car, I'd go through them. And this is all with my eyes closed in visualization. Dude, I have all my clubs. Then they'd go in the car. Then I would get in the car. And as my dad drove us to the public golf course, I would look around at the scenery. Then we would get out of the car. I would visualize bending down and putting my golf shoes on, grabbing my bag, slinging it over my shoulder, walking to the first tee, grabbing a golf club, placing the tee in the ground, teeing off. This really works. Pick your area. But what I'm saying is start from the very beginning of that wonderful place you are, or experience you had, or scenery you want, and move through it that way. It's very relaxing and it works really, really well. For me, I did that mostly to get through my CT scans. I shared with you I'm a cancer survivor. I'm a lung cancer survivor. I have to have CT scans. I get so anxious. And then going into that tube, it's not my favorite thing to do on a regular basis. This really helps. And trust me, I never get past the third hole. Okay. And then think about progressive muscle relaxation. That also works wonderfully. Again, sit back in your chair if you're listening to me, put those shoulders back away from your ears, pick your head up a bit, drop everything, put your hands on your thighs. And progressive muscle relaxation is exactly what it sounds like. Start tightening at one place. You can start at your head, you can start at your toes. So curl up your toes for me, hold them. 1, 2, 3, let go. Curl up your feet. Lift them up and curl them like you're trying to get your feet to touch your shins. Count 1, 2, 3, let go. Then go to your knees. Pull back 1, 2, 3. Then your thighs. That's mental progressive muscle relaxation. Can be done anywhere. Waiting online. You can start in any part of your body. It works. So I hope those are helpful. I know they work for me. I've used them for quite a while in the work I do with others. And you can read all about these, by the way. Pull them up, Google them. Got lots of different experiences. Let's turn for a minute, for those of you that are listening, that is supporting someone with prostate cancer, especially during the pandemic. And we know that you want to do everything you can for the person you love. Your significant other, your husband, your spouse, your wife, your dad, your granddad, your uncle, your best friend. We know that there's so much you want to do. And during the pandemic, that's really been affected because in most places, you couldn't accompany your loved one to their appointments. And you really might have felt that you were missing some information and couldn't be there for them. So here's some tips for you. We're going to run through them fairly quickly, but talk through your questions together. Okay, you should do this anyway. Should always write questions down before you bring them to your doctor's appointment. And doctors really appreciate you doing this, by the way. And don't just like leave it by your nightstand and write your questions, because then if you sleep with someone, they have to crawl over you to write their questions if something comes up in the middle of the night. Put a pad and paper in a main part of the home, usually the kitchen. Write questions down that you can bring to your next appointment. And this way, as the caregiver, as the person who loves you, they can have input as well. Ask this, hon. Hey, Dad, make sure you ask them this because I want to be able to help and I don't understand it. Here's the key too. Don't just write them down, prioritize them. So you get to those most important questions first. Because let's face it, in today's modern world, doctors don't have the kind of time that other doctors did years ago with us. So prioritize those questions the night before you go in for that appointment. Also, you can ask your loved one, take notes when you're speaking to the doctor, so that when you come home, you can share them with me. You can ask to record what happens, but remember, you need to ask permission to do that. You may not record someone without their permission. That's not allowed. okay? But that might be helpful as well. Certainly there's some telemedicine. I don't know about you guys, but here where I work, we're doing a lot of telemedicine with our follow-up appointments with our patients. And ask your partner, is it okay if you join them during the telemedicine visit? Can I be in the room? Can I sit next to you when it's on a laptop or on the phone and put it on speaker and we can listen together? So those are some things you can do to be there for your loved one during the pandemic when you can't attend that appointment. The other thing to think about, and I want you to remember, for those of you who love someone who has cancer, bad days are normal. They're normal. We have cancer. Life can be tough sometimes. Shouldn't be every day. We talked about that depression, clinical, shouldn't be progressive and all the time, but it can happen. So it's important to listen. Don't talk. Listen. And respect when someone doesn't want to talk, because that's important as well. I love this cartoon. I hope you can see it at the bottom of my screen, where it's one gentleman saying, "How do you do?" And the other saying, "Well, actually, I feel a bit teary and vulnerable right now." No, we don't usually do that, do we? No. So give someone the space to talk or not to talk. And don't talk at them. Learn to listen. I think that's important. And there is so much you can do for the person that you love. There is. You're providing support and encouragement. You're helping them talk with their healthcare team, getting those questions together. Help them with medication, with reminders. Help them manage symptoms and side effects. You can help coordinate their appointments. You're providing rides to and from, maybe handle insurance and billing issues. You can be there for them in so many different ways. And certainly, you can ask them, what can I do for you? How can I help? So there's been a lot of me talking at you guys. It's kind of a new experience. I wish you were right there in front of me, but I'm so pleased you're here no matter what. I want you to take away from this these 5.5 or 6 issues that we've talked about: emotional, social, physical, financial, resources, and support. When we walk away from emotions and feelings, sadness, anxiety, anger, distress, all of it, just put it under that big umbrella, distress. Sometimes it's hard to express how that feels. So it's really important to ask for help. Maybe you don't want to burden the person you love. You don't want to talk to them right now about how you're feeling. Maybe the person you love, you're the prostate patient, maybe the person you love can't handle the feelings for their own reasons, for their own issues or concerns. Don't keep it bottled up inside. Please, most of you, if you're getting treated in a cancer center or a hospital, there's an oncology social worker to talk to, a counselor, maybe a member of the clergy, but someone that you can talk to that can help you develop better ways of coping and talking about what's going on for you. Maybe there's that support group. Our support group is virtual. Anyone can join the Eisenhower Lucy Kirchie Cancer Center Prostate Information and Support Group. Where can you turn? I want you to understand, I love this. I was shocked that I got it off of WebMD, but I thought this was a very good explanation. Many people, especially for those of you that are in private practices, where more often than not, they don't have social workers. What do? Well, I thought this was a great definition. They help diminish concerns you might have about your diagnosis, treatment, or what's going on with you. They would provide education, would counsel about lifestyle changes, refer to community or national groups and support groups. I think that's really, really important. You know, now more than ever, especially during this pandemic, we need to reach out and plan our activities. And we talked about that as well. You know, be that social person. You can go for a walk with friends. You're outside, you can be distanced with a mask on. You can virtually connect with friends. You have to manage your energy wisely, but look for ways to stay engaged. You're here, right? You're at 0. Thank goodness you're at the summit. We did it this year. This is hugely, hugely important socially to do that. Physically, Well, we have to be mindful. There are types of treatments, the length, the extent, all kinds of ways that we're physically affected. But there are ways to exercise. I know the gyms are closed. I know for those of you that might have metastatic disease, we want to protect those bones at all costs. But there are different ways to safely keep moving. And I've already talked about the importance of doing so. Ask your doctor, ask your nurse, ask your social worker. There are ways to do this. You can ask your physician for a referral to physical therapy, because physical therapists will know what's helpful for you. You can do that. And certainly with all of these things I've been talking about, I really should have put these logos on all of these last few slides, not just the financial, but there's help for you there. Zero has, I cannot believe of the few years that I've been involved and sat on the scientific or advisory board, medical advisory board with Zero, how they have grown their programs and grown the support and grown the services they offer. I have personally had the absolute pleasure of working with and presenting to the Zero staff, who are always so interested. How can we do this better? How can we serve prostate patients and their families and their loved ones better? So thank you for that. Also, I put up Triage Cancer. You should know that the founder of Triage Cancer also sits on the advisory board for Zero. Because Triage Cancer is the only nonprofit in the country with experts that can help you navigate what we know can be a big financial burden for folks and a big source of stress and anxiety. So if you have financial concerns, don't be embarrassed. Don't hold them back. Ask for help, ask for guidance. Zero will tell you where to go. They'll help you. And then resources and support. Excuse me. I have always been taken aback when someone will come into a group or a class or a lecture and say, I had no idea you guys did this. And I'm thinking, oh my goodness, we have flyers and posters and ads in the paper and everything's all over. So I urge you, look around you. Where is the literature, the calendars, the information about programs, services, classes, whether they're offered in your clinic, your community? Google them. Google's an action verb now. Google them. Ask to speak to your social worker, and you don't have a social worker, you connect with Zero. They are extraordinary with what they can do, the Zero team, in finding you the help, the information, the group, the literature that you need to support you through this journey. Now more than ever, not just having cancer, during the pandemic, during so much upheaval in our country this last year or so, now more than ever, you need to build your team. No one needs to go through this journey of prostate cancer alone. We are here for you. Your healthcare team, your physicians, your nurses, your social workers, Zero. That's why they're putting this summit on. We are here for you. All you have to do is ask. And I couldn't resist, I'm sorry. I thought this was the best cartoon of all. It's his emotional support bar card. Thank you all for the time. Thank you.
Wow, Ali, thank you so much for that. What great tips you had across the board for patients and caregivers. And, I especially love the focus on patients and caregivers thinking about the things that they can control, because in this time we feel so out of control for everything. And I love the tip about your husband taking up a new hobby. I think I've heard so many of my friends, especially taking up new hobbies like cooking and painting and pottery and things like that. So really wonderful. I wanted to chat just about a couple of questions that we've heard from our Zero community members. And one thing we've heard from those our Zero family is that it's really hard to say no. And I think that's the case in your professional life too, sometimes, where you're battled with taking on too much. So I wondered if you could delve into that just a bit more, and do you have any tips or advice for people who really find it difficult to say no to people and to turn down an opportunity to help, but even though that's certainly in the best interest of their mental health?
What a great question. Yeah. We are a culture where no is not okay. We are, and especially in healthcare where someone's ill or have a cancer diagnosis, it's like saying no, sounds awful when they say, if someone says, well, what can I do for you? No, nothing. Or the other part of that, being able to say no when someone says, oh, you look great. Come on out bowling with us guys. And, you really don't want to. You don't have the energy. You don't have the interest. You just don't want to. So what I like to say is, instead of saying no, how about just say what you can do? Don't answer with no, answer with something different. So if someone says, I don't know, you want to come bowling, instead of saying no, say, you know what I'd really like to do? Are you free Wednesday morning? Let's go for a walk. There's this park I have never gone to. I've never taken the time, and we can do that. Grab a mask. Let's go for a walk. We could talk and catch up. Or, someone says to you, I really want to help. I'm going to come over and I'm going to drop off food. And instead of saying, no, you're a lousy cook, I'm really not interested in your food. Instead, you can say, oh, thanks so much for offering. But you know what? There's so much going on with food around me. It's like crazy right now. What would be really helpful? It would be helpful, though, if you're going to the store. I'm not going to get there this week. And I find they don't have milk and eggs. Would you mind, when you're doing your shopping, drop that off? In other words, instead of no coming out of your mouth, take a moment, think about it, and give a different answer and tell them yes or something different they can do.
Yeah, I love that, Allie. It's very similar to how I manage my children, I think. And you hate to say no automatically, but I love that idea. Let's do that tomorrow when it's not bedtime.
Right. Perfect.
Yeah, exactly.
Yeah. And now, for those of you listening, we're not calling you children. It's just a good example. Sure.
But it does help it sound and feel less negative, and I think that can be helpful.
Absolutely. And it is okay to say no. It really is okay. You can say thank you, but no, not right now. Let's revisit that later. Right. I appreciate your offer. That's a good way as well to say no.
Yeah. Perfect advice. Thank you. I also love that you mentioned the difference between the situational depression and clinical depression. I think that's something that's very difficult to understand and distinguish between when you're dealing with something so difficult. Do you have any tips or advice for patients or caregivers who might be really nervous and afraid to mention what they're feeling to their healthcare team or their provider? I think there's a stigma attached to feeling down and depressed. And I wondered if you had any pointers or advice on really just building up the courage to bring that up to your healthcare team.
Sure. I think one of the things, the messages we often get, and again, I'm talking sociologically, it isn't every man, it isn't, but in general, that's, these messages of boys don't cry, buck it up, you can cope, you can do it, it's okay. And with that comes a message, don't ask for help. You can cope with this. It's almost an admission of weakness in a lot of ways. Also, verbally saying out loud makes it real for a lot of people. It's like, if I keep it inside and I don't say anything, maybe it won't be as bad as I think it feels like it is. But the truth is, it won't go away. It doesn't go away. So if you don't ask for help, I promise you, it will get worse. You can trust me on that. Who wants that? Doesn't make any sense. Identify that person you feel most comfortable with. Start with baby steps. When I say anything's new, if you're not used to sharing your feelings, Selby, start with baby steps. You don't have to go, oh my God, I feel like I'm going to die. I'm not asking you necessarily, although you might feel that way, but I'm not saying that. Start with baby steps. Boy, I'm having a hard time right now. This is tough for me. Who can you say that to? Take a minute, think about the nurses, the physicians, We call them APPs, advanced practice practitioners, because it could be a nurse practitioner, it could be a physician assistant. Who is that advanced practice other than the physician? Do you have a social worker? It's okay to ask for one. Social workers are trained. We are trained to have a response to that. And I promise you, we'll put you at ease right away and give you lots of kudos and say, hey, you can do this. The other thing I really want to quickly mention is if you have a mental health diagnosis, if you have been diagnosed and treated for depression, it is imperative that you share that with your treatment team, just like you would if you had an ulcer, if you had heart disease, if you were taking blood pressure medication. They need to know that, because medication you have taken and or a history of depression will have an effect now on how you're being treated. So please don't hold back.
Right. Yeah, that's great advice. I mean, I think we often think of our mental health as being less important than the physical health. And obviously we all know that that's not true. So that's wonderful advice. I think lastly, what I wanted to just get a gut check from you about is, I love that you talked so much about the caregiver. The caregiver is so important, as we all know. Zero has programs for caregivers being connected to one another, and the mental health and the physical well-being of caregivers can sometimes be pushed aside during a diagnosis of any type of cancer. So I love that you talked so much about tips for caregivers. Thinking specifically about caregivers and their physical health, and maybe missing appointments and focusing on the patient. I wondered if you had any tips or pieces of advice for caregivers and making sure that they don't get, I think there's a term, caregiver fatigue, caregiver burnout. So I think maybe that, but also just making sure that caregivers are taking care of themselves when it comes to medical appointments, not skipping them, not postponing them, and making sure that they can take care of themselves so that they can take care of the patient.
So great question. The first thing is, this is just reality. If you don't take care of yourself and you get sick, what's going to happen to the person you love who needs your help? Right. Just doesn't make sense, does it? So if for no other reason than you want to be there for that person, you need to take care of yourself so you don't get sick. And trust me, the stress and anxiety and fear that leads to the neglect of yourself because you're so worried about the person you love, that's really not a way to show love, because you may get sick from neglecting yourself. How is that loving someone if you're not there for them? Because then the focus has to be on you. They're all worried about you because they see that you're not taking care of yourself, and it becomes this really kind of not very good cycle. The other thing is, at some point, the cancer patient, if they don't say it out loud, often is thinking, enough already, would you leave me alone? You're making me feel worse. Stop focusing so much on me. You know, and that's really true. You need to give them space. You need, by ignoring everything about you and having it all be about your partner, is the best word, then the message you're also sending to them is, oh my God, you can't cope. I better be here and take care of everything. Oh my God. And you're disempowering them and could make matters worse. Communication is key. No one is a mind reader. It's okay as a caregiver to look at the person you love who has prostate cancer and say, what do you need from me? How can I help? Let them identify what they do need, and except when they say nothing, just periodically come back and say, oh, okay. You know, we talked about it last week. I just wanted to check in. I'm here for you. I love you. What do you need from me?
Yeah, I love that. The attention is absolutely spot on. It is a lot of attention, and when a person isn't used to that, it can be quite a lot to absorb. So that's such a great point. Well, Allie, I want to thank you once again so much for taking the time out of your schedule to be a part of our 2021 virtual summit. So thank you so much.
You are very welcome. This has been my absolute pleasure, and I look forward to seeing all of you in person next year at the 2022 summit.
Yes,
take care and be well.
Yes, absolutely. We are very much looking forward to being in person again. I also want to have one more special thanks to our sponsor, AstraZeneca, for this session. And for more information on additional topics, please visit our website at zerocancer.org.
The issues you care about most are right here at the virtual Zero Prostate Cancer Summit. Please check out the other topics, sessions, and virtual get-togethers in your Summit app. Remember, you are not alone. Join the Zero community to gain support and more information on prostate cancer at zerocancer.org.